So we think of a low carbohydrate diet as a diet that contains less than 150 grams of carbohydrate per day. How interesting to consider, people vary so much in how much carbohydrate they have, and I'm often asked about how low to go. It depends on your individual goals, and it also depends on how you're doing. So for many people, to go down to 130 grams of carbohydrate is a great improvement on where they were before. An average diet these days will often have 250 grams of carbohydrate in it, so you're already down to nearly half with 130. But that doesn't always achieve what some of you are hoping for, particularly in terms of your type 2 diabetes or possibly your weight. I find people experiment, and as they experiment, they notice what works for them. That's what I've done personally. So I've been on the low carb diet, I think, for 6 years. And gradually over the 6 years, I've gone lower and lower. And that's because I've noticed that the lower carb diet suits me more, and I don't feel quite as good on days where I cheat or I have higher carb options. And I've noticed this same journey for many of my patients, where originally they were at about 130 grams, and then gradually they've cut the carbs down. It's very interesting that I think it was about a year ago that the Scottish version of NICE, called SIGN, are now mentioning even 50 grams of carbohydrate, which is lower than we previously thought is safe on the short term for type 2 diabetes. So it seems as if the guidelines are drifting down. And of course, if you're on 70 grams of carbohydrate and your blood glucose is still a bit high, it may be reasonable to go lower. As you go lower, it's forcing your body to burn fat for energy. Because of course we are a dual fuel engine. We can burn glucose or we can burn fat. Burning fat is good if you want to get rid of your belly fat, and also it is a perfectly good fuel, and I suppose that's what I've been running on for some time. That's actually got a name that some of you may have heard of, and that is people who are in ketosis. Being in ketosis is the scientific way of describing somebody who's pretty well just burning fat. And it's completely different from another term that's sometimes bandied about called ketoacidosis. Ketoacidosis is a dangerous thing, and it's mainly people with type 1 diabetes who are ill, and quite different from being in ketosis, which is a natural nutritional state of somebody who is burning fat for energy, somebody like me.